Okay, I think we can get started. Hi, everyone. My name is Olivia Abrams, and I am on the Emerging Leader Board of Project Lyme. Additionally, I am the co-founder and CEO of TickMit, where we create chemical-free tick protection for people and pets, which is why I am speaking with you guys today and moderating our panel. Today, we're going to be talking about vector-borne diseases in our favorite family members, household pets. Obviously, my dog is my favorite family member. And we are joined by Dr. Erin Lashnits, who is a clinical assistant professor at the University of Wisconsin-Madison School of Veterinary Medicine. So I'm going to hand it over to Erin. And if you have any questions, feel free to pop them in the chat. And once Erin's done giving her presentation, we would be happy to answer whatever questions you have. Erin, go ahead.
Thanks, Olivia. Yeah, thanks for having me. It's wonderful to talk to everyone today. Definitely, as Olivia said, feel free to put any questions in the chat as I'm talking. I do have my chat open, so I should be able to see anything that's relevant. And sometimes it's easier just to address things at the time. So I'll have some time, hopefully at the end, for some questions. Although, to be frank, I added in some extra material towards the end, so hopefully I won't run over time and run out of time for questions. Um, so yeah, as Olivia said, I am a faculty member at the University of Wisconsin-Madison School of Veterinary Medicine. I spend about half my time as a practicing veterinary specialist. So my specialty is in small animal internal medicine. Particularly focusing on infectious disease diagnostics. So I like to think of myself as sort of like a veterinary version of Dr. House on a good day, although maybe nicer, hopefully nicer. Um, and then the other half of my time I spend teaching vet students and doing research. Mainly my research is on vector-borne diseases and zoonotic diseases, and kind of the intersection between zoonotic diseases that affect our dog and cat pets and humans. So, I have no real pertinent disclosures here. I'm going to talk about a lot of sort of diagnostic testing and veterinary flea and tick preventatives. I have no real stake in any of these. But one disclosure that I should say is that I am a veterinarian. I am not a human doctor, so please use this for informational purposes only and not as medical advice. I have a handful of learning objectives. First, to have by the end of this presentation, I'm hoping that you all will be a little bit more comfortable with these. So, listing and describing common vector-borne diseases that affect both pets and people. Um, and then also listing and describing some of the high-risk diseases that can be imported or moved with pet adoption, as well as explaining how pets serve as sentinels for vector-borne disease exposure in people, and then finally recommending some steps that people can take to prevent vector-borne disease in their pets and potentially even in themselves. As far as an outline, we'll kind of go through these four different main topics and then have some time for questions at the end. So, like Olivia said, I think that sometimes our pets are our favorite family members. We know that there are many, many dogs in the United States. The estimates are put the number of dogs in the US at more than two times the human population of Canada. So it's a lot of dogs. Almost half of US households own at least one dog, and that's been a big increase. Um, and of course, there is a lot of benefits to dog ownership. However, we also know that dogs can carry truly zoonotic diseases, meaning diseases that you can actually get from your dog. That's not really the focus of this presentation, and so I listed them here because it's interesting. And it's interesting to think about what things you truly can get from your dog. Like you can, if your dog bites you, that is bad. That is a can cause an infection from your dog. You can get ringworm from your dog. These kinds of things. Um, the vector-borne diseases that I'm going to talk about mainly today really aren't zoonotic from your dogs per se, meaning like if your dog gets Lyme, you don't get that Lyme from your dog. You might also get Lyme, but it's not that same exact infection. Um, the same is true for cats. This is my own personal cat. His name is Turbo. He's 11 and amazing. And we know that cats have a lot of benefits, just like dogs. And we also know that there are a lot of cats. There's way more cats than dogs, way more owned cats, and way, way more unowned cats. And I'll talk a little bit about that. Um, as we get into the sort of pet adoption and repercussions thereof section. We also know that there are zoonotic diseases associated with cats, right? Some the same and some different. And in terms of our flea and tick-borne diseases, there are two truly zoonotic diseases that we can get from the vectors that are on our cats, and that is Bartonella and plague. And I'll talk a little bit about both of those as well as we move on. So when it comes to truly zoonotic disease risk, focused on ticks first. So we'll kind of go through ticks and then we'll go through fleas. You might get a tick that rides in on your pet, whether that's a dog or a cat. In most cases, you don't get the tick-borne disease from that tick that bites your pet, but rather you and your pet both get exposed to the same population of infected ticks, and so you might both get the same tick-borne disease. There are a handful of tick-borne diseases that do affect both dogs and people, and the main ones that I'll focus on today are Lyme and anaplasmosis. Um, Both dogs and people do get babesiosis, but actually we get different babesias. They are different species of babesia. So people get Babesia microti. Dogs get a handful of different Babesia species, but they do not seem to get Babesia microti. So actually this it's not a shared pathogen per se between you and your dog. Although again, because they're carried by vectors, right? You might get exposure to the same vectors as your dogs and then both get babesia. Um, it is a common misconception, though, that cats are less infested with vectors, meaning ticks or fleas, than dogs are. And it's not necessarily always true. Certainly, cats, especially cats that go outside, are at risk for infestation with fleas and ticks. Um, I love this paper. This is a little bit of an older paper now. I want to say it was from like 2015 or 18 or so. Um, but I love this paper because it has such nice diagrams and visuals of where we should look for ticks on our pets, for both cats and dogs. This was out of the UK where they mainly have Ixodes species ticks, so the same broad group of ticks as our deer ticks, but a slightly different species. They seem to have similar biological behavior, so I think this is still relevant to our pets in the US. But you can see that definitely like the head and neck, especially in cats, this was a big place. And the thought is that they're less able to groom off the ticks in that area of their body, right? Where it's very easy for them to pick off a tick that's on their side or their back or something like that. Um, when we're thinking about what ticks we actually find on our pets, we do find on dogs, it's a little bit, there's honestly a little bit less research in the US, but we do see kind of the same ticks that affect people. And then there are a handful of studies on cats. So this looked at the ticks removed from cats that were coming into the vet over 18 states, so sort of spread throughout the US. They looked at a lot of cats and they had a lot of ticks. And so you can see kind of this distribution of deer. These are the deer ticks, Lone Star ticks, and then the Dermacentor variabilis ticks were the least common here. One thing that I thought was particularly interesting from this study, though, was that um, over 20% of these cats that had ticks on them lived at least two-thirds of the time. So basically, like, spent at least overnight, if not longer, of the day inside. So 20% of cats that spend most of their time inside still had ticks on them. It is not entirely protective to be mostly indoor. So let's go to some of the actual vector-borne diseases that we want to talk about today. Lyme disease in dogs, of course, caused by the same pathogen as Lyme disease in people, transmitted by our deer ticks, our Ixodes scapularis ticks. Um, we do know that, again, similar to people, that the ticks have to be attached for probably 1 to 2 days for transmission to occur. Um, but that's kind of where the similarities stop. So Lyme in dogs looks different than in people in terms of what the actual illness looks like. A lot of dogs get infected and show no signs whatsoever. It's completely asymptomatic. It seems like the immune response probably clears the infection without any repercussions. However, they can have this polyarthropathy. So we'll see dogs with shifting leg lameness, multiple different joints affected. Sometimes they'll have a little bit of a fever, a little bit of blood work changes, but not always. Sometimes it is just this polyarthropathy, the multiple joints affected. And then very rarely we see this more severe manifestation called Lyme nephritis. And this is a disease that affects the kidneys, presumably where the spirochetes are causing effects on the kidneys themselves. Um, and this can be really, really severe when it does happen. This is one of the things that we see in our practice here at UW-Madison because it requires like referral and hospitalization and big vet bills and really can be very scary and can be fatal for our dogs. Um, Things that we see in people with Lyme but have not really been reported, and frankly, anecdotally, I have not seen myself either, would be some of the cardiac manifestations and the some of the neurologic manifestations, just not really reported in our dogs. When we think about how would your vet test your dog for Lyme, the thing that probably most of you are familiar with are the various options for the in-clinic screening. This is the annual SNAP test that they'll do for dogs to see if there's been any exposure over the course of the past year. Lots of different companies make these. They are all quite good as screening tests. There are two other options that we use if we get a positive on a screening test to kind of help us decide what to do with this information. Um, so one is called the quantitative C6. This is done through a company called IDEX, which is one of the reference laboratories that we send blood work to from veterinary offices. Um, and it detects the same antibodies. So it's an antibody test. It looks at the immune response to the Borrelia burgdorferi pathogen. Um, and in theory, it should be able to tell us if the numbers are really high, was that exposure recent and potentially relevant? And then if we treat the Lyme disease, right, if we treat the dog with doxycycline, theoretically those numbers should come down and we should be able to use this to monitor treatment to see if our treatment was effective. And then again, at some point in the future, we can use this to see if there's been another exposure because the in-clinic screening tests are so sensitive, they're going to pick up such low levels of exposure that sometimes they'll stay positive a long time after a single tick bite that caused exposure to Lyme. And you may not need to treat again. So this quantitative test can help us to do that. There's another test that's offered through the Cornell Animal Health Diagnostic Lab, which is really mainly, I think, at this point used for research. Although when I was in the Northeast, I do think some vets were running this as well. I have a research project ongoing looking at this test as well. So it looks at different antibodies against different antigens that the dogs would be exposed again, in an attempt to determine if that exposure was recent and if it's relevant, meaning like, could it be causing disease or is this just an old exposure that we don't have to worry about? So these are all kind of options that if, if you're going into your vet with your dog and you're thinking about Lyme, these are all the kind of options that they should be aware of. The other major vector-borne, tick-borne disease that I wanted to talk about in dogs that we see very commonly here in Wisconsin and is also very common in the Northeast is anaplasmosis. This is caused, again, by the same exact pathogen that causes anaplasmosis in people called Anaplasma phagocytophilum. It is also transmitted by deer ticks, the Ixodes scapularis. So the same tick that transmits Lyme transmits anaplasmosis. When they look at ticks, if they sample ticks out in the wild, the proportion of ticks that are infected with Anaplasma phagocytophilum compared to those that carry Borrelia is much lower. So it's a less common pathogen, but I do think we still see it fairly commonly in our dogs here. We know that the risk of infection increases the longer the tick is attached, and it seems like anaplasma can transmit a little bit quicker than Borrelia burgdorferi, particularly potentially if there are multiple ticks attached at the same time. It has to do with their co-feeding mechanisms, and that may actually increase the risk for transmission of anaplasma. The anaplasma organism infects a blood cell called the neutrophil, and it causes a particular sort of clinical syndrome in dogs, which is this acute febrile illness. In people, we would call it maybe like a flu-like illness. It can be pretty mild. It can be more severe. It is very rarely fatal. Usually dogs get through it. If they get sick enough to come to the vet, we'll give them antibiotics. It'll make them feel better quick, really quick. Um, Often there's some lameness, some muscle pain, fever, maybe some blood work changes, that kind of thing. And this is something that I think in endemic areas, right, in the upper Midwest and in the Northeast, veterinarians are very used to seeing anaplasmosis in dogs. And so we'll be able to recognize it from that clinical presentation, even though it's not super specific. We see it enough. Um, Whether anaplasmosis happens in cats is kind of an open question. I didn't even mention Lyme in cats. Cats do not seem to get Lyme. But they probably do get anaplasmosis. They probably get exposed to it and often don't get sick. They probably do get a little bit sick sometimes and we just don't recognize it. There's just less work on cats in general in the research world. So we know way less about the potential for any of these vector-borne diseases in cats. If we think about the distribution for Anaplasma phagocytophilum, just because there's a little bit less known about this, I bring this up. It kind of looks like the same distribution as Lyme, which you might expect because it's carried by the same tick. And then there's a nice paper out of one of the Canadian vet schools that looked at Anaplasma in ticks in Canada, and so sort of looking at the Canada, part of Canada butts the northeast of the US. And so they are seeing Anaplasma phagocytophilum there as well. And I've highlighted here kind of this upper Midwest and New Englandy areas that are really kind of the hot spots. So when it comes to diagnosis for anaplasma, again, we're thinking about similar things when you go to your vet. We have the same kinds of in-clinic screening tests, but actually the performance of these screening tests is really different depending on which company you use, which is interesting because that's not as much the case for Lyme. So this is something where, honestly, a lot of vets don't even know this information. So you have to be really kind of on top of knowing which of these tests your vet is using and so which one to really believe. Um, Recently in 2023, this company IDEXX updated the in-clinic tests for anaplasmosis. And so this is the one that I sort of prefer to use because I do think, based on the papers that are out, it has better sensitivity and better specificity, meaning there's less wrong results overall. It doesn't miss them, but it also doesn't come up positive when it's not supposed to. When we think about other ticks and tick-borne diseases, um, you may have heard of the Lone Star tick. This is one that has hit the news recently because the range is spreading a lot. It used to be, sort of confined or thought to be confined to the southeastern U.S., sort of coastal, warm places. When I practiced in North Carolina, it was like, yeah, we have Lone Star ticks. But it is now kind of spread from beyond that. It's even in New York. And so we do have to think about this tick now and what it carries, which I've listed here. So it can carry the bacteria that causes tularemia, can carry Ehrlichia, it can carry different rickettsias. And importantly for cats especially, it's a really good vector for a disease called cytoxoinosis, which does not affect people. So I'm not going to go into it too much here, but it's a very, very severe and rapidly fatal disease for cats. So in places where there's lots of these Lone Star ticks, we really watch out for that for our cats. We talk about dermacenter species ticks. They are just overall less common ticks in our cats and dogs, but they do carry Rocky Mountain spotted fever, which is another disease you may maybe have heard of. Um, and then the last tick that's really important for dogs is the dog tick, as the name would suggest, right? Um, so this is a tick called Rhipicephalus sanguineus is the scientific name. It typically will only bite dogs. So it's like a kennel tick of dogs where there's a lot of dogs and they're not on preventatives. This is the tick that you'll find in just huge numbers. But what we know is that in extreme infestations, it will bite people. Um, and it can spread Rocky Mountain spotted fever. And there is this area in sort of the southwest US and into Mexico where there's a lot of endemic Rocky Mountain spotted fever in communities with a lot of community dogs. that are not on preventatives that have huge infestations of these dog ticks. And so it's people that are getting infected from dog ticks, which is too bad because they are really preventable. And Rocky Mountain spotted fever is very serious and can, especially in children, be fatal. So I put kind of the background here as just a news story about one of these outbreaks. And if you look at the news in that area of the country, you'll see that it is kind of running rampant. It's a big public health concern down there. Okay, so we're going to shift our focus a little bit now and move away from ticks and onto fleas, which I think this picture make look really scary, so that's good. When we talk about fleas, what pathogens do we care about? Why do we care about fleas? Aren't they just sort of a nuisance? So actually, no. They carry a couple of different pathogens that we really care about and are really serious. And so one of those is Bartonella, which I'll talk about in a little bit more detail. Another is plague. Of course, we all know like plague, like the Black Death, was mainly transmitted by rats and rat fleas. But in the Four Corners and out west in the US, we have areas of the US that there is plague endemic in wildlife. And so every so often, cats that interact with those wildlife can get plague, and their fleas can get it, and they can bring it into people. And so it's something that we do have to think about in that part of sort of Four Corners area of the country. And then there's also a number of different rickettsial organisms. These are bacteria that have not been studied all too well. They're related to Rocky Mountain spotted fever, but there's a lot of different species of them. And some of those live specifically in fleas. And we don't know too much yet about what kinds of disease they cause in dogs or cats or people, although we know that some of them do cause disease in people. And then, of course, like, yes, fleas bite and it is itchy. And some pets are really, really bothered by this. And so, outside of the flea-borne disease risk, I do always like to mention sort of the flea allergy dermatitis. And sometimes it is really hard to find the fleas, especially in cats, because they're such good groomers, right? They will bite. They will eat each flea as it hops on, but they will also scratch, and that the allergens that the flea saliva presumably puts on the cats as they're biting causes a really bad, itchy, horrible skin reaction for our cats. So something to really think about is more than just a nuisance. When we're talking about fleas, how common is this? Is this a really big problem, or is it just, every so often we might run into one? There was a study about 10 years ago now that looked at all of the different fleas and ticks, ectoparasites, is the, sort of veterinary word for that, on cats in Oklahoma. And these are outdoor cats. So these are cats that are not on preventatives. They're high risk. What they found was that 70% of those cats had fleas. And they found fleas year round, even in Oklahoma, where, the winter it doesn't get super, super cold like it does in Wisconsin, but it's not hot. And then they found about 20% of those cats did have ticks at any given time. So certainly a bigger problem. Fleas are thought to be a bigger problem in cats than ticks are. There's also a study across the entire UK looking at owned cats. So these are not high-risk cats. These are owned cats that are coming in to veterinary offices in the UK. They found over a quarter of those cats had fleas, and these are owned cats. So this is a really big problem. And if you don't go look for it, you probably won't find it. They found about 15% of dogs in that same study had fleas. So again, our cats are more affected by fleas, often because it's harder to notice because they are good at grooming them off, unlike dogs. The other information that we have from the US is really not great information. So this is a graph from some data from Banfield Pet Hospitals, which probably all of you have seen, out there in your shopping centers, your local shopping centers. Um, so they basically went through all of their records to see which. To see what proportion of cats had somebody had written down in their medical record that they had fleas. Um, this is also over 10 years old now, which is the most recent data we have from Banfield. But you can see the proportions. So just even writing down that they had fleas, which is probably way underestimating because not every cat is going to get flea combed when they come into the vet. It was anywhere from, not very common, less than 1% to up to about 20% in the Pacific Northwest. And so actually just even updating like this basic knowledge on how common fleas are in cats is another part of the research that I do in my lab, trying to kind of figure out like where are there the most fleas, where are there the most flea-borne pathogens, what are some of the risk factors, and then how do we really intervene to help our cats. Um, because I like fleas but also hate them and they're gross, I thought I would spend just a minute talking about them a little bit more in detail. If anybody wants to learn more about the life cycle, there are some really interesting but kind of gross videos on YouTube. So feel free to type this in and watch those in your own time. Um, but this is basically what a flea looks like, really, really zoomed in on your cat or dog. They move fast and they're quick, and these two ones that aren't moving are probably dead. Obviously, the one that's moving is going along. So they do hop. If you try to grab it, it will hop out of the way, but they also can do this kind of quick walk. Um, so you can imagine that you might part the fur of a pet and they all run out of the way really fast, and so it's hard to find them. Um, they also have this interesting life cycle in which it's easy for them to spread disease because they eat continuously or nearly continuously blood meals from their host. So they bite the cat or dog, and as they're eating, they're basically pooping out little bits of blood that's digested through their GI tract. And so you get this flea poop coming onto your skin. And if you've ever heard of flea dirt, that's just a nice way to say flea poop. Flea dirt is flea poop. It's just the dried blood that comes out of their GI tract after they metabolize what they need out of it. And that is what it looks like on your pet. So it does, I mean, it looks like dirt, so I get the name. But then if you can see that in the background here, there's kind of this like paper towel, and this is a moistened paper towel. So a little bit of water on a paper towel, and you blot it on, and that makes the blood dissolve a little bit, and you can see that it gets a little bit rusty or red, and that's how you can tell that this is flea dirt and not just like dirt. Dirt will just come off, right, and not turn into blood when you get it wet. You can even do this at home if you're worried and you see this on your pets. These are flea eggs. This is how fleas propagate. They lay these eggs. The eggs are so small, so you would never notice this in your house or anywhere. Even it's really hard to find them in the fur of pets or anything. And they basically drop off the fur into onto your floor, into your carpet, into your bedding, wherever, into the cat bed, wherever. And then they hatch and they become larvae, and then the larvae feed, and eventually when a larva detect a new host, they detect a potential host that they can feed on the blood of, they jump onto that host or they crawl onto that host, and then the life cycle starts again. So why do we worry about fleas from the pathogen side? So one of the reasons is this pathogen called Bartonella. Bartonellosis is the kind of doctor word for the disease. And cats are the reservoir host for this Bartonella called Bartonella henselae. This is the pathogen that causes cat scratch fever, or cat scratch disease, if anyone has ever heard of that. And the main risk is actually the fleas. So the cats are the host. It sometimes can make cats sick, but it doesn't always. Um, but the flea then takes up the blood meal, which is infected with Bartonella, and then defecates out infectious Bartonella in that flea dirt. Then, when you go to scratch your flea bite, or when the cat goes to scratch its flea bite, or potentially even when the flea bites, or if you have a cat and you haven't gotten any flea bites, but you have a cat that has fleas and it scratches you, it can inoculate that flea dirt in through the skin, causing Bartonella to get in through the skin as well. Um, there are a lot of potential manifestations of Bartonella in people, as well as in dogs, as well as in cats, and a ton of other species. I'm not going to go into great detail on the manifestations in people, but feel free to ask if anyone has questions. Um, and some is known about Bartonellosis in people, less is known in dogs and cats, but it certainly can be a pathogen in all of the species. And then just to talk a tiny bit more about plague, because it is something that we have to think about in both the veterinary community and in human medicine. Cats are just really highly susceptible to plague. And they can transmit it to people. So if a cat gets infected, they can transmit it. And you'll see this hit the news every so often, when a cat gets it and transmits to the owner, and it'll hit my news because all the vets at the practice that sees the poor sick cat will have to go on antibiotics because they got exposed. So this is a just a visual representation. This is from CDC data, last updated sadly in 2023. I just checked on this this week, and there's not anything updated since 2023. But this is all the cases of human plague in the U.S. So you can see it is mainly focused in this Four Corners and then out west. These cases that are not in those places are travel related. So not necessarily like, oh my God, somebody in the UP got it. But they were this, I looked this person up because I was curious. And there was a news story from a few years ago. They had been traveling in Colorado and then was just diagnosed when they got back to Michigan. There are fatalities from plague every few years. So these dark blue bars are people that died from plague in the US. So you can see it does still happen. So we need to still think about it. Um, then I mentioned rickettsial disease as a potential for zoonotic diseases carried by fleas from cats. There's a couple of different rickettsial diseases. One is typhus, which you've probably heard of from like history, but again, is still present in the US, particularly in a couple of areas in Texas and California, and I think Hawaii, I heard recently. And th this is transmitted by fleas, and cats may play a role in this life cycle. It's just not very well researched. Then the final thing I wanted to mention on our sort of vector-borne tour of dogs and cats is tapeworms, and they are gross, and people have heard of them. Um, tapeworms, the same tapeworm affects dogs and cats, which is called Diploidium caninum. Um, and you can't get the tapeworm from your pet directly. But if you accidentally eat a flea, then you can get that tapeworm. And that is actually how they get it. So, especially cats will, when they're grooming off the fleas are infected with tapeworms. They groom off the flea, they eat it, and that's how they get infected. And these little sesame seed-like things are the dried up segments of the tapeworms inside the intestines, this is inside the intestines. So, everybody I think is familiar with the sort of like sesame seed look of these. If you find these, if your pet has tapeworms, the most important part of getting rid of them is to also treat for fleas, because if you don't treat the fleas, they won't go away. Okay. So we're about halfway, and I wanted to go into some of the other things that are not specifically about, individual vector-borne diseases, but just thoughts for you all as potentially pet owners or people interested in this kind of human-animal interface. So one of these is thinking about the practice that we now do of transporting pets, dogs, and cats for adoption. Um, we know that there are risks to this practice, including exposure of personnel doing the transport or people adopting the pets to zoonotic disease from dogs that are sick or dogs that are even carrying disease. Of course, rabies is a big concern, not a vector-borne disease, but certainly zoonotic. Um, and globalization and global travel leads to these risks for dogs as well as for people, right? Like we know that people get exposed to more infectious diseases now that there's an easy way to get across the globe within a day. So things like canine influenza, brucellosis, rabies, these have all been potentially imported into the US from international travel from dogs. We also know that dogs can bring in non-endemic parasites, meaning um, fleas, ticks, not necessarily fleas, but ticks and other types of parasites that are not supposed to be here in the US, but can be brought on dogs, um, and some of the diseases that these parasites carry. Um, the last thing that I'll mention too about this is that dogs, especially dogs, can act as fomites, meaning they can be like the carrier of a pathogen, even if they're not infected by it. For example, foot and mouth disease is a really severe pathogen for hoofstock, for cows and goats and that kind of thing. Um, if dogs are housed in areas in other countries that are contaminated with the pathogen that causes foot and mouth disease, the dog's not going to get it, right? Like they are not susceptible to it, but they might have the pathogen on their fur. And if that comes into the US, it can affect our livestock, and that would be completely disastrous. Certainly thinking about those kinds of animal importation risks is important. I wanted to mention a couple of the diseases that we think about specifically. One is leishmaniasis. This is a systemic disease that is mainly found in Central and South America, and then as a separate sort of separate disease, also in the Mediterranean basin. Um, there's been now proposed criteria for how to appropriately import animals from these parts of the world into the States so that we don't accidentally import leishmaniasis, which has definitely happened. I have clients that brought a dog from Spain with leishmaniasis. And so right now we don't have documentation that that's caused like now spread in the US, but certainly we still see cases of dogs that come over from Europe or come from Central or South America and bring this disease in. The same is probably true for this disease called Chagas disease. It is mainly seen in Central and South America. But this graph here, or this map with the graphs, shows the proportion of dogs that show exposure to Chagas disease, and it's huge proportions. And these are Homeland Security dogs, so they're dogs that do have travel history, but they're spread all across the US because of this practice of traveling them. Um, and so this is probably because we move these dogs all around. And we know that there are areas certainly in Texas, where this is now like just out there. Um, and lots of dogs, even not Homeland Security dogs, are getting exposed. Um, the CDC has a couple of nice references on like things to think about if you are considering bringing an animal into the US for adoption. And I think that's important because like we do sometimes need to do this, right? If your family moves abroad and moves back or something like that. But also sometimes the overseas adoptions are, welfare concerns and ethical concerns and that kind of thing. And getting dogs new loving homes is really important. So we just want to do that without risking the spread of infectious disease and vector-borne disease. We don't know a ton about this in cats, but there are definitely people that are doing sort of an international trade in cats, particularly certain purebred cats. Um, and so we want to think about all of these considerations when we are rehoming our cats, particularly like what their lifestyles are in their natural environment, and then how they're going to do when we try to rehome them and put them into like a house with people. This is all from a website called iCat Care. And so if this is something that's interesting to you, definitely take a look at they have a lot of good references and resources on like appropriate rehoming of cats and what to do with this spectrum of, what we would call stray. Well, some people would call stray, right? But are not all these stray cats, these cats that don't live inside in people's houses, are really, really a huge variety of different lifestyles. Um, so we don't really know how often this is happening in the US, but in the UK, there's a lot of work being done because apparently there's a ton of overseas purchasing of cats from Europe into the UK. And this is important just because of the same reasons it is in dogs, right? We see that cat diseases can be spread across borders, of course, when the cats are. There is some overlap with dog zoonotic diseases, so cats can be affected by leishmaniasis and Chagas, and so it's something that we do have to consider in the US as well. Um, when we think about relocating cats, we also have to think about relocating their vectors. And so definitely something to consider when we're thinking about our cat rehoming. And then I wanted to bring this up too because the UK has this proposed guidelines of how to appropriately import cats, and I think they're really nicely done. I only have one change that I would make, which I crossed out in red here, and I would say rather than just being concerned about ticks and tapeworms, I would be more concerned about ticks and fleas and the broad suite of GI parasites, not tapeworms alone. Um, Thinking about pets as sentinels, this is a topic that comes up every so often in sort of the One Health context, right? What do I mean as pets as sentinels? Dogs can be infected with a lot of the same pathogens as people. So this is a paper that actually looked at a lot of the new emerging zoonotic diseases in humans and kind of highlighting which ones dogs can. dogs can be infected with and how often we're looking for these in dogs. So you can see a lot of these, not just vector-borne diseases, can be found in dogs as well. And so because they're out there in the environment sharing, vectors, but also sharing environmental exposures with people, they can certainly serve to give us the heads up that something is going on in dogs even before we catch it in people. This can be the same in cats as well. Cryptococcus is a fungal infection that cats are very susceptible to. And you can see based on this map that there's a lot of overlap between the human cases in the circles and the animal cases in the squares of this fungal disease. So we don't want to leave out our cats again. Um, if you're interested in any of this information from sort of the continuing education side, these are all really good sort of public-facing websites about parasites and vector-borne disease in companion animals, so in dogs and cats. So I definitely would encourage you to go take a look through these if you ever have any questions. And then finally, we think about sort of spillover and the potential for zoonotic diseases that exist out in nature and wildlife to cross into human populations. And we know that dogs and cats can serve as that bridge sometimes. Um, and so whether it's thinking about dogs and cats as a bridge for spillover or purely a sentinel, I thought this one was a nice example because this is this new Asian longhorn tick, the Hemophysalis longicornis, and there's ongoing surveillance for this tick going on across the U.S. Um, this graph is updated as of this week, so you can see that a lot of these ticks are found in the environment. People go out and flag for them. But the next highest place where these new sort of invasive ticks are reported from is collecting them off of dogs. And you can even see cats make it down here more than just a handful. So it is important to use our pets even, as surveillance when it does come up. All right, and I'll spend the last few minutes here talking about sort of with all of these risks and with all of these dangers and diseases out there, what can we do? How can we protect not just our pets, but also ourselves? So one thing is thinking about like, what do we do when we get a new pet? Um, One thing is knowing that we can share pathogens, not just vector-borne ones, but any infectious disease between dogs and between cats. So when we get a new dog or cat, we do want to do a good job of isolating or quarantining them before they come in contact with our, existing pets. We also want to do a good job of feces management. Cleaning litter boxes, picking up poops, making sure that any of those fecal oral pathogens aren't sharing between dogs and cats. And for cats especially, keeping the stress minimal will help to prevent recurrence of any like particularly herpes virus or other kind of chronic long-term pathogens that come out during times of stress. And that can really happen when they come into new houses because it's a stressful time. And then we also want to make sure that all of our preventative care is done before they actually come into the home. So if this is done at the shelter, that's wonderful. If it's not done at the shelter, you want to take them like directly from the shelter to the vet and get your flea and tick preventatives, your vaccinations, your deworming, get all of it done before they come into the home environment. And certainly before they come out of that sort of isolation, like before you let them out of the bathroom to meet the rest of the herd, you want to have all of that preventative care done to keep everyone healthy. Um, Again, the CDC has some really nice information on healthy pet practices. I'm not going to go through these in detail because you can easily look them up. And a lot of it is common sense, of course, but things to prevent not just vector-borne disease, but particularly zoonotic diseases that cross between dogs and cats and people. And then when it comes to the parasite side of things, the flea and tick side of things, there's so many options and it can be a bit overwhelming. So I have a few sort of guidelines and again, trying to remain like brand neutral to the greatest extent that I can. Um, One thing to think about is the more quickly a product acts to kill ticks, the lower the probability that pathogens will be passed from the tick to the host. Um, so we know that there's kind of a range of like some pathogens are passed within hours and some take days, but we do have a lot of information on like how long it takes. So we know that transmission of Lyme can occur within maybe 24 to 48 hours of attachment. Rickettsial pathogens can be even faster. They can be like 5 to 10 hours, depending on the tick species. Anaplasma is also pretty efficient, um, can be within 1 or 2 days, um, is most efficient after a longer period of time. So again, like every day counts at that point. Um, we know less about Ehrlichia species. We know how they transmit in other countries with sort of other um, non-US based species of Ehrlichia, but we don't know as much in the US about Ehrlichia transmission, which is interesting and kind of too bad. And then there's also the protozoal diseases. So those are like the Babesia and the Cytox. Those transmit more slowly. Those do take a couple of days before they can transmit. Um, but tick-borne viruses, so you can think about Powassan as a good example. They can take just minutes. Powassan can transmit within 15 minutes of attachment. Of course, transmission timing can be influenced by other variables like interruptions to feeding and maybe multiple, co-feeding multiple ticks on the same animal. But overall, like the bottom line is the longer an infected tick is alive and feeding on a host, the greater the risk of pathogen transmission. So all that is to preface, there are a bunch of studies on the speed of kill. So how effective different preventatives are at actually killing the tick so that it falls off and can't do that transmission anymore. And so this is just a figure from one of these really recent papers looking at three different companies' version of the same sort of idea, which is the monthly chewable that does flea and tick prevention. So you can see here the way that they did this was by experimentally infecting dogs. So they took a bunch of dogs and then they put a bunch of ticks on them. And then they gave them these preventatives and they saw how quickly the ticks died. Um, so the day that they gave the medication lasts for a month. The day that they gave the medication, they looked at the number of ticks on these dogs. And for the first 12 hours, there were still a lot of ticks on these dogs. This is the first 12 hours after they gave the preventative. So that makes sense. Like if your dog got a bunch of ticks that morning and then you gave the preventative later that day, like, okay, it's going to take a minute. Um, but by 24 hours for any of these, the numbers are cut way down. And then by 2 to 3 days after giving it, they're almost at zero. So really effective within just a couple of days. And all of these did a really good job on that sort of first day. A place where we did see a bit of difference was at that month time point. So like right before you're about to give the next dose. How good are these still doing? Um, they put a bunch of fleas on and then they measured them after a few hours and there's still a handful on. This one medication called Credelio seemed to do a really good job still after about 24 hours. So it took about 24 hours for that medication to kill all the ticks, but it did really do a pretty good job of killing all the ticks still within 24 hours. So in an ideal world, you don't want to wait 24 hours to kill all the ticks, but you'd certainly rather have them be killed at 24 hours than waiting till 72 hours, right? Thinking about speed of kill. It's better the shorter time that you can keep those ticks on the dogs, the better. So this is the place where it may be that this medication, Credelio, is a little bit more effective at that point than these two. But remember, this is at the very end of treatment, and you're redosing right away then. And so it may be a little bit less important at that day 28 than it is on day 0, where they're all really good. The other sort of big picture component is to look for something that can actually not just kill the tick once it's on the dog, but actually repel the tick. So these oral medications cannot do that. They kill really quickly, often within 24 hours, which is awesome, but they don't have that same repellent capacity. And the repellent capacity, again, is important because what we care about, obviously, is preventing disease, and we want to keep the ticks off of the dogs so they don't even bite at all. For cats, we know that the only safe repellent is flumethrin. There's another one for dogs, which is called permethrin. I'm gonna back up. Just for cats, flumethrin. The only preventative that I kind of know about that has flumethrin is the Seresto collar for cats. Um, there's been some studies on fipronil, which is the active ingredient in a lot of the flea and tick preventatives, and it really isn't that effective at the repelling component. It's really good at the getting rid of, but it doesn't have that same repellent capacity. For dogs, you have a little bit more option. You have permethrin or flumethrin. Permethrin is just extremely toxic for cats, so we don't use it for cats. So you have these topicals, the squirt-ons, and then you also have the Seresto collar for dogs. Um, One thing that I do think is really important to know is that the Seresto collar has been studied in actually preventing the diseases that we care about, not just the ticks. So there's a couple of different studies in both dogs and cats, but one I want to highlight is this one that I quote here, um, where Seresto collars were used to study transmission of anaplasma and Lyme in dogs, which again, the two big ones that we care about in dogs. All of these dogs were infested, those were experimental research beagles that ticks were put on them, ticks that they knew had Lyme and anaplasma. They were put on them within 1 month, 2 months, and 7 months of putting on their Seresto collar. The Seresto collar lasts for 8 months. They put on these infected ticks 1 month, 2 months, or 7 months after putting on the Seresto collar. And then they tested all these dogs to see if they had any evidence of exposure or to the pathogen or infection with the pathogen. In the control dogs, so the dogs that got a fake collar that didn't have any medication in it, almost all of them had exposure or infection. So 12 of 16 for Lyme and 14 of 16 for anaplasma. And in the dogs that got those Seresto collars, like the actual ones, not a single dog had any evidence of exposure or infection. So it does show, it's a limited number, 16 dogs in the control group. I think they had 35 or 40 in the experimental groups. But still, not a single one of them had exposure, which makes me feel more confident to say that like this is doing the thing that we really care about, which is stopping exposure to the disease itself. So, with that, I'll hopefully end on a hopeful note, which is that prevention is possible, right? Like we can prevent exposure to these diseases. I myself have had two dogs of my own that I've been in charge of their medical care, and they've both had Seresto collars strapped onto them their entire lives, and none of them have ever come up positive for Lyme or Anaplasma. Despite one time, my poor old dog got a ton of ticks when we were hiking in Tahoe, but somehow managed to escape getting tick-borne disease. So I think whatever we were doing was working. So anyway, I'm happy to answer any questions that you have. We have about 10 minutes left here for questions. I have my references here. This is really just selected references that might be good for people to look at. And then here's my contact information if anybody does want to get in touch. I'm happy to take any questions.
Thank you so much, Erin. This was a great presentation. One question in the group, which I think is super interesting, are why are Lyme laboratory tests so much more accurate in dogs than in humans? Why are we able to get such a better read on Lyme disease in our animals rather than in people?
Yeah. Yeah, it's a really good question and something I myself wonder a lot about. And I have to also admit my own ignorance of sort of the diagnostic testing in people. Like I know how it is diagnosed, or some of the diagnostic tests, but I don't know kind of the underlying biology that sort of has led to the development of those tests, and why we have this. So um, I don't know if I can go back in a quick way, but I might be able to. While I'm talking, I can scroll backwards. The different antibodies against the different antigens that are expressed by the Borrelia organism in the tick versus in the dog on infection, is kind of how this Cornell panel works. And I don't know how that relates to what is done in people, nor how that C6 peptide, which is the one that the in clinic um, tests are based on, how that relates to what's done in people either. Um, so yeah, unfortunately, that's my own ignorance of the human side. But there has been a lot of work done by these diagnostic labs to really optimize their antibody tests, their ELISA tests that are done in these little bedside, cage side snap tests. And they're quite good, and they don't. We are also lucky in veterinary medicine, unlike in human medicine, to have a vaccination against Lyme disease. And it is fairly effective, although it's not as effective as some of our vaccinations in vet med. But yeah, so the other nice thing about our testing is that it does not cross-react with the vaccine, which is nice because then our vaccinated dogs we know can have both protection from the vaccine plus protection from their tick preventatives, and we're able to test them when we need to. So yeah, we are in a much better place in veterinary medicine than we are in human medicine.
Yeah, it's definitely true, and I hope that we can get to the same place that we are in zoonotic disease than we are in more of the human diseases that we're seeing, especially when it comes to diagnostics. Someone else asked, can bird flu be transmitted from birds to pets and humans? Do you know anything about bird flu?
Yeah, I had a few slides on COVID and I had a few slides on HPAI, and I took them out because I didn't want to run out of time. But so I apologize, I don't have slides for this. But um, the main way that we're seeing current iteration of avian influenza affecting pets is in cats that are exposed to raw milk, or raw diets containing um, infected tissue, I guess. But the ones that I know most about is the cats that, like the barn cats at the dairies that have infection. Um, Presumably, they can get it from also from eating birds. I think that honestly, it's maybe a little bit less common or less commonly noticed, because certainly cats eat birds, like that is a thing that happens. Um, but right now, it does seem a little bit geographically contained. Like we have not seen any cases here in Wisconsin. So I think in the places where there's worse um, infection in the dairies, we're seeing worse infection in the cats. I have not heard about it in dogs yet, and that again maybe is my own ignorance. But it's not something I'm aware of in dogs. I will say too, though, bigger picture with influenza virus in general, we know that like influenza has a hugely broad host tropism, right? Meaning like lots of different influenzas can infect lots of different types of animals. And so if you remember back to like the 2000s when swine flu was a thing, there were cats that got that. Um, there were even people that got infected, presumably from cats with it. So it can, in settings in which there's like a high viral load and you're not taking appropriate PPE precautions, right? Like at that time, nobody was masking, um, that it can cross species barriers for sure.
Okay. Yeah, that makes a lot of sense. Someone asked, could I put the preventative collar on my dog when I take them out on hikes, or does it need to be on constantly in order to be effective?
Yeah, what a good question, and something that has not been um, really addressed in the literature in a meaningful way. The company that makes Seresto wants you to leave it on all the time. Um, and so they've done all of the research has been on dogs where it is on all the time. Um, it's from the biology of it, it like the from what I understand of the like this pharmacology that's kind of complicated actually is like the active ingredient that's in the collar actually like gets into their skin and coat. And so it should have some lag where like if you take it off, like I take my this resto off when I give my dogs a bath, but then I put it back on once they're dry. It seems like that should be fine from the biology of how it works, but nobody's really looked into it. Um, the other thing that I think is interesting is my dog's daycare takes off all of their collars at daycare so they don't get hurt, including Serestos. So at daycare all day, my dog doesn't is outside running around with a bunch of other dogs with no Seresto collar on. But it doesn't. It seems like it's been fine. That's completely anecdotal. Um, I will also say, though, based on that anecdotal experience, one of the things that I'm working on with a research project with actually an undergraduate pre-vet student here at UW is to look at the actual way that people actually use preventatives in the real world and see if we can identify any risk factors for um, more or less exposure to Lyme or Anaplasma with any of these particular practices. Because the other practice that we'll get asked a lot about is seasonality. Like it is hard to justify giving flea and tick preventatives in, deepest, darkest February in Wisconsin when there's 3 feet of snow on the ground and it's, in negative temperatures every single day. Like there are no ticks out. Biologically, that is impossible. But then in March, when we get the 40-degree day, like, man, do we need to start those preventatives right away? So we are trying to look at in point of actual use, what are some of those risk factors, and are some of these things okay or not okay, and how can we best do it to maximize the effectiveness without like making it impossible to actually do.
Right, right. Yeah, and what I've seen a lot is that there is also a huge trend when it comes to more holistic and chemical-free alternatives to flea and tick medications or preventatives, whether that is, a Wondercide flea and tick collar that may be more based around lavender and eucalyptus. And then, of course, there's also tick mitt, which is an easy way to get ticks off of your dogs before they actually embed into the skin. So there's really so many options out there. And I think, as Erin mentioned earlier, like some things work for dogs, some things work for cats, some things work for people who have children in the house versus people who don't have children in the house. Everything is very specific as to, every dog and the situation that they're in. And so it's really important to have these conversations with their veterinarians. Unfortunately, we have run out of time, but Erin, if you want to pull up your contact information, if anyone else has any other questions that we weren't able to get to today, you can contact Erin at the email on the screen. We really appreciate you taking the time to listen in on the webinar today, and please subscribe to Project Lyme's newsletter so that you can be informed when our next webinar is coming up. Thank you all so much.
Thanks, everyone. Thanks for having me.